안녕하십니까. 온라인 서저리의 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won of Online Dentistry. Today I'll be walking you through a surgical video. The case involves a 72-year-old male patient who first visited us due to discomfort in the upper right molar region as seen on the panoramic X-ray. Initially, my recommendation was to extract teeth number 16 and 17 due to significant alveolar bone destruction and mobility. In tooth number 17, however, the patient was reluctant to proceed with the extraction, leading to a delay in treatment. Eventually, due to increased pain, the decision was made to extract both teeth. We then performed the socket preservation using AOS collagen without a collagen membrane. OneCAS was used and 2 implants were placed in the number 16 and 17 along with AOS bone graft material. Looking at the CT scan of the number 16 region, you can see significant buccal bone destruction around the buccal root with some palatal bone loss as well. The number 17 region also shows notable buccal bone defects. Although tooth number 16 had a minimal mobility, tooth number 17 had slightly more significant mobility. After extracting the teeth, socket preservation was performed using AOS collagen without use of collagen membrane. And as you can see, even with a slight exposure, the soft tissue healing can occur nicely if you use the collagen. Extractions were done, socket preservation was done, and the CT scan shows the buccal defect filled with AOS collagen. Approximately 2 months later, panoramic X-ray was taken. 3 months later, CT was taken again, and decision was made to proceed to surgery. Preparations were made, as you can see, for number 16 KS3 BA surface 5.0 by 10 mm, and for number 17 KS3 5.0 by 8.5 was planned. In number 16, you can see that the minimum distance from the implant top to the inferior margin of sinus floor is 6.35 millimeters. And following that, OneCAS drill was chosen, and initial drilling was planned for up to 5 millimeters. Crestal approach was planned to do hydrolift and bone graft. As for number 17, 5.0 by 8.5 was planned, and the sinus floor would be slightly penetrated without additional bone graft. OneCAS drill was planned for use. So this is a OneCAS drill sequence for number 16. The residual bone was assumed to be 6 millimeters, so 5 millimeter drilling was done. 2.2 initial drill along with 2 millimeter stopper was used to drill up to 5 millimeters. And because this is where socket preservation was done when using OneCAS, I assume that it's going to be softer bone. After expanding the drill to 3.8 millimeters, the plan was to penetrate the sinus floor, perform hydraulic lift of the membrane, and place the implant. That was the plan for this patient. In today's video, in my case, at times people ask me, recently 1 to 2 taper drill has become used by many. In the case of OneCAS drill, it's straight drill. A lot of people ask, what final drill should I use when placing 5 mm diameter implant? For soft bone in the posterior maxilla, I typically use a final drill size of 3.8 mm, creating a 1.2 mm gap. If you use OneCAS, because there's contact with one guide, it's difficult to get tactile sensation. If you take a look at this case, 3.8 was used as final drill, and if implant placement was not properly, if you look at this video, It went in about 50%. If the torque is excessive, you can remove implant and do final drilling up to 4.1. In the case of this patient, 5.0 was placed after doing final drilling up to 4.1. In number 17, 5.0 by 8.5 was planned. The sinus floor would be slightly penetrated. Bone graft was considered unnecessary. OneCAS drill would be used here. The plan was to use a final drill up to 3.8 millimeters. This is immediate post-op image. It's been 3.5 months after socket preservation. If you look on panoramic image in number 16 on top, there is sufficient amount of bone graft material. Graft materials are more towards distally, but no additional bone grafts was done for number 17. In number 16, in dome shape, there's bone graft material. In number 17, no additional bone graft was done. On the palatal side, implanted top is within the sinus slightly. As the surgery was done, AS collagen, which was used for socket preservation, was harvested using trapline drill for biopsy. You can see in blue there's new bone formation. You can see that new bone formation was achieved after doing socket preservation using AS collagen. This is 3 months after, and this is panoramic image in number 16. Graft material is nicely maintained. In number 17, as mentioned earlier, bone graft was not done additionally, and especially towards the palatal side, the implant is slightly deeper than the inferior margin of the sinus. This is at final prosthesis. It's been 7 months since socket preservation, and it's 3.5 months after implant placement. This is at 1 year, 1 month of follow-up. CT was taken after 1 year and 1 month. In number 16, crystal approach was done for bone graft, and it's nicely healed. If you look at immediate post-op image from October 2022, the graft material are maturing over here. And in number 17, it's been 1 year and 1 month since the surgery, and you can see that compared to immediate post-op CT around the implant top area, there is a slightly more bone. In general, the implant apex was slightly more deeper towards the palatal side, but there can be bone fill-up even without additional bone graft. Let's see the surgical clip. The one guide is adapted. OneCAS is used here. Tissue punch is used to remove overriding mucosa. As you can see, there is no stopper in tissue punch. Number 16. Number 17. Template is removed to check whether overriding gingiva has been nicely removed. Template is adapted once again.
지금은 아,
Flattening drill is used from number 16. Number 16 and 17. 6 millimeter was assumed, so 5 millimeter drilling is done first. 7 millimeter with a 2 millimeter stopper. So initial drilling is done up to 2.2 using 5 millimeter. 2.8 by 7 millimeter drill and 2 millimeter stopper. Drill hole is expanded up to 5 millimeters. 3.8 by 7 millimeter drill with 2 millimeter stopper as mentioned. Because it is upper posterior, I assumed it was soft bone, and final drill was at 3.8 drill. The sinus floor is not penetrated. 3.8 by 7 millimeter drill with 1 millimeter stopper. Gradual progression is done by 1 millimeter. Drilling is done up to 6 millimeters. It's not penetrated. Depth gauge with 4 millimeter stopper is used. The stopper is not in contact with the template, so you can check that the sinus floor is not penetrated. Next is 3.8 by 7 millimeter without stopper. Drilling is done up to 7 millimeters. In the case of OneCAS, a drill hole is expanded, and while using final drill, you need to progress. It has been drilled up to 7 millimeters, so 3 millimeter stopper is used on a depth gauge. You can see there's contact. Sinus floor is penetrated. Hydrolift is done with the template. 3 cc syringe is used to advance at 0.5, and then aspiration is done with repetition. You can see that we're going in. Upon aspiration, blood regurgitation is observed. There's very little air, so there is a negative pressure. Sinus membrane. This means sinus membrane has been lifted without puncture. Sinus membrane lift is done. Upon aspiration, there's negative pressure, so there's no membrane tearing. Bone carrier is used to put in EOS bone graft material. Bone condenser is used to perform bone graft. This is irrigated graft material. Condenser is used to place the bone graft materials in slowly. If you put in excessive amount, it can be blocked. You need to move forward gradually. Syringe is used to remove the cell line inside. This is to concentrate the bone graft material and to prevent any dead space. KS3 implant BA 5.0 by 10 millimeter implant is used. Final drilling was done up to 3.8 with 1.2 gap. The assumption was that it was soft bone, more so than thought the bone was harder, so it did not really go in. In this case, I removed the implant. Final drilling was done up to 3.8 and bone graft was done. So drill's hole is expanded up to 4.1. Drilling was done up to 7 millimeters, and with the bone graft material, the drill hole is expanded because of the density of bone. KS3 5.0 by 10 millimeter implant. The final drill is up to 4.1. Before placing the implant, more so than thought, the bone was harder because of long-term inflammation. I think the septal bone area was harder. Implant driver and hand wrench was used to get final implant position. The bone was harder than expected due to prolonged inflammation. You can see that there's a sufficient primary stability. Yellow marking is utilized to check the final position. Next, moving on in number 17. You can see 2.2 by 7 millimeter twist drill is used without stopper. 2.8 by 7 millimeter drill without stopper is used to drill up to 7 millimeters. Sinus floor was slightly penetrated with 8.25, so 3.8 by 7 millimeter drill. 3.8 drill is used as final drill. With the 7 millimeter drilling done, 3 millimeter stopper is used to check whether sinus floor penetration is done. You can see that the template is not in contact. A 3.8 by 10 millimeter drill with 2 millimeter stopper is used. This is final drill and drilling is done up to 8 millimeters. In my case, OneCAS, in the case of posterior, I assume this to be soft bone. So there should be 1.2 millimeter gap. 2 millimeter stopper is used to check whether there has been sinus floor penetration. You can see there is contact. Upon 8 millimeter, there is partial penetration, and in this stage, without no further sinus membrane lift, KS3 BA 5.0 by 8.5 millimeter implant is placed. I think the bone is less harder here. And final drill was done up to 3.8 and the implant is placed. A torque ratchet implant driver is used to get the final implant position. It's slightly less than 30 Newton centimeters. Yellow marking and the triangle is utilized. ISQ value is measured. Number 16. It was quite hard, so ISQ value is up to 80. Initial torque seems increased in number 17. It is 64. It is slightly less than 70. In today's video, today's lecture centered around the question I received when placing tapered TS3 implant when using OneCAS drill. Because the drill is straight, people find it difficult to choose the final drill. Because it is upper posterior, you have to assume that it is a soft bone. In order to place a 5 millimeter diameter implant, 3.8 is recommended. As for OneCAS kit, because it comes in contact with the guide, it's difficult to get a tactile sense, so you need to have a 1.2 millimeter gap. 3.8 millimeter final drill should be used first if the implant does not go in, not even half. If the bone is harder than expected, you can use a 4.1 drill to expand the drill hole. I thought the bone would be harder, and I only drilled up to 3.8, and I showed you how the drill hole size was expanded when the implant did not go in as planned. I hope this video was of help when you use a OneCAS drill or OneCAS kit.
도움이 되는 영상이 되기를 바랍니다. 시청해 주셔서 감사합니다.